Hello, guys. Welcome to Neurology 2 Minutes Concept, and our topic today is hydrocephalus. So, the hydrocephalus is defined as an increase in the cerebrospinal fluid within the brain ventricles. To understand hydrocephalus, first understand the mechanism of CSF production. The CSF is produced through the choroid plexus in the lateral ventricle especially. From the lateral ventricle it flows to the third ventricle with the help of foramen of Monro. Through the third ventricle it flows into the fourth ventricle with the help of cerebral aqueduct, which is also called as aqueduct of Salvius. Through the fourth ventricle it goes into subarachnoid space with the help of foramen of Megendie and foramen of Luschka. In the subarachnoid space, it gets absorbed in the blood with the help of arachnoid granulations. Now let's discuss the causes of hydrocephalus. Number one is due to the overproduction by the choroid plexus as seen in the choroid tumor. Number two is absorption problem at the level of the arachnoid granulation. And number three is obstruction in the flow of CSF from one ventricle to the other. In child, the sutures are not closed, so there is an increase in the head circumference and the downward direction called as sunset gaze. But in adults, the cranial sutures are closed, so there is no increase in the head circumference, but there is an increase in the intracranial pressure characterized by vomiting, headache. Types of hydrocephalus: communicating hydrocephalus, non-communicating, normal pressure hydrocephalus, and hydrocephalus ex vacuo. In communicating hydrocephalus, the communication between the ventricle is normal. So the problem is at the level of arachnoid granulation, at the level of absorption. In non-communicating hydrocephalus, the communication between the ventricle is not normal due to any obstruction like tumor. In normal pressure hydrocephalus, the lateral ventricle is overdilated due to which more CSF is accumulated. But the pressure here is normal. It manifests by Hakim striate, in which there is gait problem, urinary incontinence, and dementia. Hydrocephalus ex vacuo is a compensatory increase in CSF area due to brain atrophy. So the treatment option is creating a shunt. A shunt is basically a connection between the ventricle and the other area. For example, ventriculoperitoneal shunt, in which you allow CSF to move from ventricle to the peritoneal cavity, or ventriculoatrial shunt from ventricle to the right atrium. Thank you.